Hi, it's Jeff from East Indiana AHEC here to look at another common student question about health careers. This video will look at the question, what's the difference between a nurse practitioner and a physician assistant? There are definitely some similarities. Both nurse practitioners and physician assistants are currently master's degree level occupations. That means you're looking at about 2 years worth of graduate level classes after you get a 4-year undergraduate degree. And there are some similar job responsibilities. Both a nurse practitioner and a PA might work in an outpatient setting, examining patients, diagnosing their conditions, and recommending treatments and therapies. But there are also some differences. Let's take a closer look at PA programs first. Physician assistant degree programs tend to be set up for full-time students. Sometimes these will be adult learners, but just as often they'll be younger students who have just finished undergraduate degrees. In addition to classes where you learn clinical skills, you'll take a full load of science classes that look pretty similar to the list of science classes in medical schools. Since PAs work closely with physicians, their curriculum is modeled after the medical school curriculum. Physician assistants don't do any kind of residency or specialized training after they graduate, though. They gain specialized training on the job depending on what kind of physician they work with. Some PAs might work with family practice or internal medicine physicians and develop primary care skills. Other PAs might work with surgeons or cardiologists and be involved with the technical and procedure-oriented skills that those kinds of doctors use. Now, let's look at nurse practitioners. To get into a nurse practitioner master's program, you need two things: a Bachelor's of Science in Nursing degree and work experience as a registered nurse. You can't enter nurse practitioner school straight out of undergrad like you can PA school. You have to have that work experience as a nurse. And you can't enter nurse practitioner school with a wide variety of undergraduate majors like you can PA school. The nurse work experience requirement means you'll have to have had a nursing major. Nurse practitioner education programs might be full-time or they might be part-time, built for working nurses. Nurse training is built around a model that includes things like communication, patient counseling, and looking at a patient's whole lifestyle and family situation as part of his or her diagnosis and treatment. That's not to say that PAs do not counsel patients or talk about patient lifestyle, but as a generalization, PAs are a little more procedure-oriented and nurse practitioners are often a little more patient education and patient lifestyle-oriented. Nurse practitioner programs do allow for some specialization, mostly around different types of patient populations. You might train to be a family nurse practitioner, a pediatric nurse practitioner, or a mental health nurse practitioner, for example. And while many nurse practitioners work in hospitals or in physician practices under the supervision of a doctor, there are some states that let them practice independently. Let's review and wrap up. Both nurse practitioners and physician assistants have to earn master's degrees to be in their fields. You can go to PA school right out of college, while you have to work as a registered nurse first before you can start nurse practitioner school. PAs tend to be a little more procedure or technical skill oriented, while nurse practitioners probably get more education about patient counseling and patient lifestyle issues. For both careers, what they actually do on a day-to-day basis as far as seeing and treating patients really depends on their specific job and work setting. And for both careers, growth in job opportunities is expected to be good as demand for both NPs and PAs increases. As a high school or early college student then, the real question for you is, do you want to attend nursing school for your undergraduate degree and have that registered nursing background before you take the next step to becoming an NP? Or do you want to do a non-clinical undergraduate degree, probably in a science field, before applying to PA school? A good way to help you decide is to look at the nurse practitioner and physician assistant details and descriptions at the website explorehealthcareers.org, and also look for opportunities to job shadow with one or both professions to learn more about their daily work and education requirements. Thanks for watching, and as always, check out East Indiana AHEC's website for more health career resources.